The Model Systems Knowledge Translation Center presents Sleep After Traumatic Brain Injury. This slideshow is based on research conducted by the Traumatic Brain Injury Model Systems and serves as a resource for individuals with traumatic brain injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This presentation summarizes research on sleep problems that people with TBI may have. The information can help people with TBI who suffer from sleep disturbances recognize the symptoms and seek treatment. Not sleeping well can increase or worsen depression, anxiety, fatigue, irritability, and one's sense of well-being. It can also lead to poor work performance and traffic or workplace accidents. Sleep disorders are 3 times more common in TBI patients than in the general population. Nearly 60% of people with TBI experience long-term difficulties with sleep. Types of sleep problems include insomnia, difficulty with falling asleep or staying asleep, or sleep that does not make you feel rested. Insomnia can worsen other problems resulting from brain injury, including behavioral and cognitive difficulties, excessive daytime sleepiness, extreme drowsiness, delayed sleep phase syndrome, mixed-up sleep patterns, narcolepsy, falling asleep suddenly and uncontrollably during the day. Common sleep syndromes are medical disorders of the sleep patterns. These include restless leg syndrome, the urge to move the legs because they feel uncomfortable, especially at night or when lying down, bruxism, grinding or clenching teeth, sleep apnea, brief pauses in breathing during sleep, resulting in reduced oxygen flow to the brain and causing loud snoring and frequent awakening. Periodic limb movement disorder, involuntary movement of legs and arms during sleep. Sleepwalking, walking or performing other activities while sleeping and not being aware of it. What causes sleep problems after traumatic brain injury? Some causes of sleep problems are physical and chemical changes. The internal clock in the brain controls when people sleep and wake every day. If injured, the brain may not be able to tell the body to fall asleep or wake up. There are chemicals in our body that help us to sleep. An injury can change the way that these chemicals affect the body. If brain mechanisms for starting and stopping sleep are injured, a condition called post-traumatic hypersomnia may result in which a person sleeps many hours more than normal. Changes in breathing control. Sometimes the brain's ability to control breathing during sleep becomes altered after a TBI, resulting in periods of apnea, when breathing actually stops for long enough for blood oxygen levels to drop. Medications. Medications taken after a brain injury may cause problems going to sleep or staying asleep, or can make people sleepy during the day and unable to participate in activities. Daytime sleeping or napping and physical inactivity. Napping during the day is likely to disturb sleep at night. Inactivity or lack of exercise can also worsen sleep. Pain. Many people who have suffered brain injuries also experience pain in other parts of the body. This discomfort may disturb sleep. Medications taken to relieve pain may also affect sleep. Depression. Depression is much more common in persons with traumatic brain injury than in the general population. Sleep problems, such as difficulty falling asleep and early morning waking, are common symptoms of depression. Alcohol. Alcohol may help bring on sleep. Drinking alcohol before bedtime is likely to interfere with normal sleep rather than improve it. Caffeine and nicotine. Nicotine from tobacco may cause sleep disturbances and is often overlooked. Caffeine can disturb sleep when consumed in the afternoon or evening. What can be done to improve sleep? Some daytime suggestions to improve sleep include: set an alarm to try to wake up at the same time every day. Include meaningful activities in your daily schedule. Get off the couch and limit TV watching. Exercise every day. People with TBI who exercise regularly report fewer sleep problems. Try to get outdoors for some sunlight during the daytime. If you live in an area with less sun in the wintertime, consider trying light box therapy. Don't nap more than 20 minutes during the day. Some nighttime suggestions to improve sleep include: try to go to bed at the same time every night and set your alarm for the next day. Follow a bedtime routine. For example, put out your clothes for morning, brush your teeth, and then read or listen to relaxing music for 10 minutes before turning out the light. Avoid caffeine, nicotine, alcohol, and sugar for 5 hours before bedtime. Avoid eating prior to sleep to allow time to digest, but also do not go to bed hungry, as this can also wake you from sleep. Do not exercise within 2 hours of bedtime, but stretching or meditation may help with sleep. Do not eat, read, or watch TV while in bed. Keep stress out of the bedroom. For example, do not work or pay bills there. Create a restful atmosphere in the bedroom, protected from distractions, noise, extreme temperatures, and light. If you don't fall asleep in 30 minutes, get out of bed and do something relaxing or boring until you feel sleepy. If your sleep problems persist, talk to your doctor to explore safe and effective solutions. Evaluation of sleep problems should include a thorough history of such problems, medication review, an assessment of your bedtime routines, and a comprehensive medical evaluation. Before recommending any action, your physician will explore with you a variety of possible causes for your sleep problems, including pain or depression. If necessary, he or she may recommend a polysomnographic evaluation, also known as a sleep lab. Based on your symptoms, medical history, and specific needs, your doctor will be able to make a personalized treatment plan to help you achieve restful sleep. Some treatment options are non-pharmacological therapies. Alternatives to medications include counseling, sleep restriction, relaxation therapy, and phototherapy. Medications. Ask your doctor about medications that can help you sleep through the night or keep you awake during the day. Special care is necessary when choosing a medication to avoid daytime sedation or worsening cognitive and behavior problems. Natural remedies. Some consumers have found herbal teas, melatonin, and valerian useful for sleep problems. These are sold in health food and drug stores with no prescription needed. Consult with your doctor if you are using them. For additional resources on living with a traumatic brain injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.